Well, good evening and welcome to the COVID-19 pandemic updates. I'm Kayode Okikilo and apologies for starting a little bit behind schedule. But first, the highlights. Jigawa State gets first and only oxygen installation unit from international organization Save the Child with a call for more of this across the state. The World Health Organization advises Nigeria not to relent in observing hand hygiene so as to flatten the coronavirus curve. And the United States throws its weight behind World Trade Organization's bid to remove COVID-19 patent protections. Well, Nigeria continues to record more COVID-19 cases and sadly more deaths as the pandemic seems poised for a long-drawn battle, which is why we must never drop our guards. Yes, the cases aren't coming in at the rate we saw earlier in the year, but if there's anything we've learned about this virus, it will be its sneaky nature. But it has one weakness. It is handicapped. Without people moving it around, it can't do much. So that's mankind 1, virus 0. Well, we have a breakdown of the latest figures just for you. Take a look.
Nigeria has recorded 52 new cases of the COVID-19 virus from 6 states and the Federal Capital Territory. The new cases were reported in Taraba, which had 18 cases, while FCT and Rivers had 9 cases. Lagos, the epicenter of the disease, recorded 7 cases. Akwa Ibom had 6. 2 cases were recorded in Kano, and Kaduna had 1 case. The agency says its latest report includes data from Taraba, recorded between 22nd April and May the 4th. The total count of confirmed cases recorded in Nigeria now stands at 165,273. According to the agency, 2 new deaths were registered last night, about 1 week after the last recorded death from the virus. This brings the total number of deaths from the virus in Nigeria to 2,065. 32 people have been discharged in the last 24 hours after testing negative to the virus, bringing the total number of discharged cases to 155,403. There are currently over 7,000 active cases, while 1.9 million samples have been tested so far. 63% of Nigeria's target population have been vaccinated, according to the latest update by the National Primary Healthcare Development Agency. Globally, more than 155 million cases and over 3.2 million deaths have been reported across several countries. Meanwhile, the NCDC says that a COVID-19 post-arrival test has now become mandatory for all travelers arriving into the country, adding that they must observe a 7-day self-isolation at their final destination. The agency insists that a PCR test must be carried out on the 7th day of arrival at a selected accredited private laboratory in the country.
Well, an oxygen system for patients with respiratory difficulty is being installed in Dutse, the Jigawa State capital, to reduce mortality rate, especially with COVID-19 patients. The Chief Medical Director of the Rashid Shekoni Teaching Hospital, Dr. Magaji Mahmood, who explained that the new installation will boost the recovery rate of patients down with COVID-19, is also appealing that the oxygen system be replicated across the state to save more lives.
The index case of coronavirus in Nigeria was recorded on February 17, 2020. Since then, the virus has spread to the entire country. In Jigawa State, the government and other relevant authorities are making efforts to improve healthcare delivery in the state. Before now, the only tertiary hospital in the state capital was lacking an oxygen system. But the non-profit international organization has come to the aid of the state. A 20 million naira worth oxygen system is being donated.
What we are donating today is not a flashy equipment, it's not a large item you see, but it's something which is so strategic and so important to saving the lives of children and even adults in this hospital.
The Chief Medical Director in the hospital calls on the government to replicate the project in smaller health facilities across the state.
This project is a giant stride in improving the quality of care of this hospital. to save the lives, to reduce suffering of children, and of course, they extended that gesture to include adults in our accident and emergency unit.
The state government, however, maintains that such health facility in each of the 270 wards across the state will help flatten the COVID-19 curve.
The state government has, as at now, been able to achieve establishment of at least one healthcare establishment in each of the wards in the state. And we have about 287 wards in Jigawa State.
An intervention by the state government in the provision of oxygen in all health facilities will indeed help in no small measure in saving the lives of infected patients.
So there's also been that never-ending call for adherence to non-pharmaceutical interventions like the wearing of face masks, hand hygiene, physical distancing, and the rest, all in a bid to just try and get a lid on the virus. But there's a psychology to all of that. And thankfully, notable researchers in Nigeria have done some work that might help us understand just how Nigerians think and how to better craft the message so it can hit home. One of those academics is Professor Peter Pigwa, a professor of psychology at the University of Ibadan. He joins us on the program live. Well, it's great to have you on the program, Prof. Now, if there's anything governments at various levels have complained, it's great to have you. If there's anything governments have complained about the most, it will be that a lot of people don't seem to be on the same page when it comes to adherence. Add to that vaccine hesitancy. And in spite of government sensitization for over a year now, the situation still seems to be the same. Are we missing something here?
Yeah, thank you so very much. It's actually correct that, of course, people are actually not adhering to the instruction to wear face masks, instruction to wash their hands, to sanitize, and all of that. But again, when you look at Nigerian generally, it's as if there's this general defiance. And of course, when you look at that, it's because when this thing broke also, the government that was telling people to wear face masks and not wash their hands and all of that, it's as if the government itself was not very serious about the thing. Now, in the early days of the lockdown, when there were deaths and all of that, government rolled out certain things that must be done. But you realize at some point, the government itself was handling the thing badly when some high-profile people were concerned and all of that. So, of course, there is general pervasive thing in Nigeria that people do not trust the government. Now, when you do not trust the government and that government is telling you to do particular thing, people are quite hesitant to do it. And of course, again, we have this general idea that, look, it can never happen to us. This Nigeria, we are Nigerians, we are godly people, and all of that. These are part of our psychology that is making people not to adhere to what the government is saying. It's a mentality of it cannot happen to me. You see something happening to somebody, and of course, they are asking you to take precautions. Just look at it and look, it can't happen to me. It's a kind of psychology. It can't happen to me. So until the thing affects you, you are not really serious about it. So there is general defiance in Nigeria. It's not only about COVID-19, even about some other issues. Issues are even life-threatening. Of course, when you receive information, the first thing you want to talk about is the credibility of the source of the information. If you perceive that the source is credible, then you want to adhere. But you perceive that the source is not as credible, you may not want to adhere. And again, the thing is about perception of risk. If the information is not properly put out there for people to see that they are threatened personally, then people tend to believe that it is not meant for me. I've seen people in the wake of the COVID-19 pandemic say, look, it's only affects rich people. Oh, no, it only affects those people who travel out and come back into the country and all of that. So there was a general misconception because the message was not strong enough as to the causes. The message was not strong enough as to the fact that anybody can be affected. There are so many misinformation flying out there.
Now,
people are not getting the correct kind of information.
Now, speaking of crafting the correct information, I mean, reading through one of the works you co-authored, I found something quite interesting, and I had to cover my face on behalf of our agenda. Apparently, there's a relationship between gender and precautionary behavior. Can you shed more light on that?
Yes, you see, that story was quite interesting. Of course, what we tried to do was to look at how knowledge of COVID-19 and risk perception can actually influence precautionary behavior. And of course, we actually did establish that, look, the perception of risk has something to do with precautionary behavior. We found that those who perceive higher risk tend to take more precaution. And of course, there's also this slight difference between males and females on precautionary behaviors. The females tend to be more cautious. They tend to take precautionary behavior, precautionary initiative than the male. Of course, that's quite interesting to us because if you look, COVID-19 is affecting all of us the same way. Why are we then finding a difference between the male taking precautionary measures and the female taking precautionary measures? But that is what our findings has thrown out. Of course, we then begin to say, okay, messages should highlight the risk more strongly, and that of course we also have to put out the message in such a way that the male folks will also take it more seriously, so that they can also take more precautionary behavior, just like the female folks were found to be taking. It's quite interesting, of course. And when we look at all of this trajectory, we just realize that we may need more research in this direction to know how we can put out the message. And of course, you see, again, we tend to leave out the academics, we tend to leave out researchers in the things that we do. There are ways you put out information that will appeal to people. Now, you ought to understand the population, the dynamics of the population, and the way this population is structured. You ought to understand how to craft a particular information to focus the youth, how to craft information to focus the male and the females. This is a diverse society. You cannot just pick one information, put it out, and think it will appeal to different stratum of the society the same way.
I think
this is the research we are talking about.
Pardon me, that's a very important point you touched on, and I imagine that some of these findings should have been taken up by government. So on a final note, how well is government collaborating with researchers, especially psychologists, in coming up with more effective messaging and campaigns?
Yeah, thank you so very much. Well, in this country, research uptake by policymakers is quite abysmally low. I mean, one would expect that if government has a problem or there's a problem in the country, that government will look towards the university to say, come, what do we do? How do we handle this? But then when this the COVID-19 broke, emphasis was too much on the medical thing. We left out the behavioral scientists, we left out the humanities and all of that. So I think going forward, that the government should look towards the university. What are you doing? What are the research people are doing that can help society? When you look into the university, when you look into research, you fund research, and you see people coming up with things that can actually assist government in coming up with good policies and in implementing these policies.
I think that's a very important point to chew on, but we'd like to thank you so much, Prof, for sharing your thoughts with us on the program. And moving forward, some of these recommendations will be taken up.
Okay, thank you. So too.
Well, we'll go on a break now, and when we return, we'll touch on the topic and the debate around vaccine patent. That's going to be interesting. Join us again. Welcome back. The Global Hand Hygiene Day may have come and gone, but the message should never leave us, which is why the World Health Organization and the state government in Yobe have conducted capacity building for 40 healthcare workers on COVID-19 infection prevention and control. Well, the plan is to maintain global sustainability of hand hygiene in healthcare services to reduce the spread of COVID-19.
As you may know, hand hygiene is one of the most important infection prevention and control measures to prevent infections like COVID-19 and acute watery diarrhea. So we are using this opportunity to sensitize the public and build the capacity of healthcare workers on infection prevention and control. So I want to use this opportunity to call on everyone, men, women, and caregivers, to always maintain hand hygiene in the community.
Well, so much is going on the foreign scene, and I'm not talking India, at least not yet. It's a debate around vaccine patent. Now, you know how you invent something and get it protected by patenting or trademarking it just to prevent copying and to also ensure that you benefit financially from your work? Well, that applies to vaccines as well. And there's a major spat brewing between big pharmaceuticals that have developed COVID-19 vaccines and countries that are calling for a temporary lifting of intellectual property rights so it can be cheaper and more accessible in this pandemic period. So much questions. How does this work? What lies ahead? And so much more. Well, let's join Dr. Gabrielle Macaulay, who's the medical director of MAHA. She joins us from the UK. Thank you for being a part of the program. Let's begin with a debate around vaccine patents. Well, the US is asking vaccine manufacturing be liberalized, so to speak, so that poorer countries can produce in-country to meet their demands. And I'm just wondering, is this a no-brainer, or there's more to this, at least from the medical perspective?
Yeah, I don't think it's a no-brainer. I think it's a very important and a very good question, because removing patents is not going to solve the problem that we have. There are still many bottlenecks that need to be addressed. So, for example, there's a lot of problems with free trade. It's not so easy for people to trade vaccines or send vaccines from one country to another. There's also issues with scarcity of very important ingredients that are used to create the vaccines, and then also an unwillingness for richer countries to share vaccines with poorer countries. So these are things that need to be thought about. And if we're able to get rid of patents and just have generic vaccines, we have to make sure that vaccine efficacy is not compromised and make sure that vaccine safety is not compromised. So we have to share information on how we're going to make the vaccines easily accessible for all. No one is safe until everybody is safe. And it's really a tragedy that only 0.3% of the COVID vaccines in the world have been given to the poorer countries. And only 1% of people in poorer countries have been vaccinated, as opposed to much higher percentages in the UK, in America, and in Israel. So in the UK, we're at 52%.
You know, critics of this waiver plans say that producing COVID-19 vaccines is complex, just as you referenced, and setting up production at new facilities might compromise the quality of the vaccines and even stifle innovation. Now, let me latch onto that last point, because stifling innovation also talks about financial reward, definitely. So do you think that people sometimes expect too much from those in the health industry, forgetting that it's business for them too?
Well, all of these pharmaceutical companies, they are businesses, they have shareholders. So companies like Pfizer, Pfizer-BioNTech, and also Johnson & Johnson, Pfizer and Moderna, they are selling the vaccines at over $30 per vaccine. Whereas companies like AstraZeneca, they are selling the vaccine at cost price, so it's a lot cheaper. You have to remember that pharmaceuticals have to have incentives to be able to put masses and masses of money into the investment into vaccines. And we don't want to put these companies off from, doing all this groundbreaking work in the future. So it's really a balancing act in terms of thinking about price of making these vaccines and also selling them.
So clearly you think this is going to be a tricky one. But you know what also bothers me is that debate on this at the WTO, where, most of the decision will be taken between member countries. This debate might take months. Months. And you've seen the fatality rates across countries, the infection rates. And if these talks take months, I wonder just how many lives or how many infections will have been recorded. You would expect that for something this crucial, it will take very little time to be debated. Does that also worry you?
So the bottom line is that we don't have months and years to come up with these decisions. We have to make sure that the bottlenecks that I mentioned before are eradicated. So this is trade bottlenecks, this is not sharing of vaccines, and this is also scarcity of ingredients. We have to make sure that there is enough ingredients and that we can ramp up the scale of production. And we have to make sure that those who are the most vulnerable are not left behind, and that we can increase the vaccination rates in the poorer countries. 1% of vaccination rates in poorer countries compared to 52% in the UK, it's just not good enough. We have to make sure that everyone is vaccinated and that everyone is safe if we're all going to be safe.
Well, let's round off on this note. Let's head over to India. I know you worked there briefly and you've seen the health system. So maybe you understand why this is happening in India. There are fears that there might be another India. In fact, Nepal is pretty scared, thinking we might be next. How do we stop another India from happening?
I think it's really, really difficult to stop the spread of COVID once levels hit a certain rate. So, for example, the UK found it very difficult to control cases, but the UK is a very privileged country. So to be able to lock down completely is a privilege. To be able to have running water to wash our hands, alcohol gel to clean our hands, these are all privileges. To be able to have really good healthcare is a privilege. And for a lot of people to be able to work at home, from the comfort of their living rooms with their laptops and having internet is a privilege. Now, in countries like India and Nepal, a lot of people do not have this privilege. So to kind of use the same tactics to lock down completely when families have to feed their children, it's just not an option for a lot of people. So it's going to be very, very difficult.
Oh dear. Well, Dr. Gabrielle Macaulay, the MD of MAHA, thank you so much for joining us on the program.
Thank you for having me.
Well, more updates on India. Pope Francis has encouraged medics in the country to stay strong as they battle the coronavirus pandemic. Well, he sent this message to the Catholic Bishops' Conference in India, offering his heartfelt solidarity and spiritual closeness to all the Indian people. Here's more on the Global Update.
Russia has authorized the one-shot Sputnik Light version of its COVID-19 vaccine for use, a move that could help vaccine supplies go further in countries with high infection rates. Developed by Moscow's Gamaleya Institute, the slimmed-down vaccine, which the RDIF says is 79.4% effective against COVID-19 and costs $10 a dose, has been earmarked for export and could increase the number of people with partial immunity. Russian President Vladimir Putin has described his country's vaccines as safe as a Kalashnikov assault rifle. Indonesia has introduced a scheduled internal travel ban today in a bid to curb coronavirus infections at a time when millions would normally travel home to mark the end of the Islamic fasting month. Police were deployed across the capital, Jakarta, to check documents and prevent travelers without specific permits from leaving the city. Travel ban was announced last month and will last from May the 6th to the 7th during the National Eid al-Fitr celebrations. Tokyo's Governor Yuriko Koike says an extended state of emergency is needed to contain COVID infections in the city. With current infections straining the medical system in the capital, the state of emergency extension could raise further questions about Tokyo's ability to host the Olympics. Japan had hoped that a state of emergency will contain a fourth wave of cases, but the measure has failed to halt an increase in new infections. Finally, in the United States, while the school year has been disrupted by the pandemic, schools are trying to provide some students with one-on-one psychotherapy sessions to address mental health needs. Schools in some districts like Parkland School District in Pennsylvania have provided a much-needed momentum to boost mental health care for its student population. Educators across the country agreed students' mental well-being became a bigger priority after the pandemic forced schools to shut down or operate with a mix of remote and in-person learning. Some students struggled to focus, and isolation, worry, and depression took a toll on many.
One more thing, don't forget to protect yourself because the virus is still out there. Continue to take responsibility and visit our website, channelstv.com, for more updates and better understanding of the pandemic. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikulu. Do stay safe.